Well, the news that Boris Johnson has now got the virus, together with a number of senior members of the cabinet and politicians, and also the chief executive of Public Health England, Duncan Selby, indicates just how widespread the virus is now. And we've suspected this for some time. The problem is we don't really know how many people have got it and which parts of the country are affected. The only way we can tell is by the number of deaths and serious admissions to hospital, because we haven't got reliable data from testing. So we're really functioning with one hand behind our backs, or in the dark, if you will. And I think it just underlines the fact that the measures that have been taken were very slow to be put in place. And it's so important now that we make them stick, because this virus is circulating, certainly in London in the southeast, probably across the Midlands, increasingly into the other towns and cities, and eventually into the more rural areas and small communities. What we've learned this morning is about this Operation Cygnus that was carried out in 2016, which was a very large-scale exercise to test the country's ability to cope with an influenza epidemic. And there were a lot of things came out of that, not least the fact that we didn't have the capacity to deal with an emergency on the scale that we're now seeing. And this report seems to have been buried, not acted on. The chief medical officer at the time, Sally Davis, was very concerned about this. And it really is very scary that a major report like that should have been buried and not acted on. Since that time, we've seen further cuts in the public health budget. We've seen continuing weaknesses in the public health system. And clearly, a lot of the things that were identified there, such as ventilator capacity and other aspects of the kit that needed to be available, were not put in place. And, this has just drifted through over the last 2 months. We saw the failure to convene COBRA at the beginning of February, when the Prime Minister could have got a grip, could have ordered the PCR machines to do the testing. They've had the army going around the country taking PCR machines out of university laboratories to try and increase the capacity over the last week or so, but also ordering the personal protective equipment, which is in such short supply, and which means our frontline workers, our doctors and nurses and other NHS staff are at risk, and that the hospitals themselves are becoming infected, and they can become the source of a secondary epidemic. I mean, this is something that we knew about from history, from other outbreaks, the great pandemic flu of 1918-19, where the hospitals themselves became part of the problem. And it looks as though that may be happening now because of the failure to prepare, to anticipate, to plan, to order, and to equip. The other thing that comes to mind here is that we've now seen in recent days a succession of senior people and VIPs getting access to testing when frontline medical staff haven't been able to get testing. And I'm afraid this seems really unfair. If there's scarcity of testing, then surely the people who need to be first in the queue are those who are saving life. We've had Prince Charles was tested, found positive, and then he's gone off to Scotland to sit out the emergency in the rural areas of Scotland. At the same time as we've been trying to prevent people going off to Snowdonia and other parts of the country. So there's some issues here about that. I'm sure, people joined the spirit of clapping for the NHS last night. I did myself, but there's something not quite right. seeing the people who failed us at this time now joining in that, when really they need to be getting on and doing what's needed to help the country get on top of this and reduce the number of deaths. I think what we've seen on a number of issues, starting really with the three amigos, the chief medical officer and the chief scientist, either side of the prime minister, is that we've seen the prime minister outsourcing the responsibility for the actions that need to be taken. The government not taking charge and taking responsibility, but deferring each time there's an issue. It was the same with the school closures. It's the same now with whether we should have rationing of food to make sure that poorer people and people who really can't get out and about get access to food, outsourcing the responsibility of that to the supermarkets, rather than saying we need to have a fair system of rationing in place. So we've seen this outsourcing, and it's only when push comes to finally shove that the government's been prepared to take the measures that we should have been taking some time before. As we've begun to address some of the areas that need to be tackled, like events, pubs, clubs, workplaces, and so on, then the spotlight has begun to highlight some of the other settings and places where people spend their time and which are particularly risky. And, I've been very bothered about the prison environment, particularly since the reports 3 or 4 weeks ago of outbreaks in prisons in China and in Iran, and where they released large numbers of prisoners who were coming towards the end of their sentences, released them early to reduce overcrowding in the prisons. And I've been saying we needed to do that here. Unfortunately, because of the way in which we as a community tend to think about prisons and prisoners, there was not much sympathy for that approach. And so none of that's happened so far. But what it means now is that we've got cases in, I believe, 10 of our prisons, in either prisoners themselves or guards, prison guards. And this is really worrying, because for each case that's there now, we may see 2, 3, 4 cases over the next few days or week, and we may well see outbreaks in prisons across the country. And remember that this isn't just about prisoners living self-contained lives in the prison environment. You have the prison guards coming and going to their own families, to their own homes, neighborhoods. You have other workers coming in and out, maintenance workers, and other folk who are involved in the prison, the carers themselves, the health service people in the prison environment. And this can really be problematic, because if you're going to have to test and triage and quarantine something like 100,000 people in our prisons, including many dangerous people who you might have to move around from one place to another to concentrate particular groups in particular prisons, we could have avoided that, or that we could have had a good chance of avoiding that, if we'd been rational and hadn't let our emotions get in the way of doing the right thing. Many people will have been shocked this week to hear about the care home in Spain, where residents were found dead and the staff had abandoned the place. And we know that the care homes across this country are very variable in their standard. They're often underfunded. The environments are not necessarily good. And the recent trend has been to build ever larger care homes with up to 120 or 130 people in them, where if you get a case, the potential is for there to be a complete outbreak affecting all those people who are likely to be frail, particularly people perhaps with dementia, and where we really could have a terrible tragedy on our hands. This is something which has been pretty obvious for some time, but it's only in the last few days that we've heard mention of it by government and by the emergency planning people. As the country closes down and people stop working, most people stop working in a workplace, but working from home if they can, or not working actually, we're also seeing very large numbers of volunteers come forward, which is great, particularly younger people, able-bodied people, people who may be able to shrug off the virus. But what that means then is that the home itself becomes in the front line for further transmission, particularly where you've got people coming and going from the home environment and who are mixing with other folk in the community. What we really have to do now is to isolate the elderly and the other vulnerable groups, heart disease, diabetes, chest conditions, immune compromise, cancer, and so on. They need to be isolated in their own home environment. And the younger ones, and the ones who are active, frontline workers, volunteers, need to probably move out of houses where they've been living with those vulnerable groups and be billeted elsewhere, or move into a house with friends who don't have an elderly or vulnerable person in. So what needs to happen is that the hotels, boarding houses, schools need to be brought into use for billeting these conscripts and volunteers who are now our army in this war against the virus. My understanding is that because of poor action and links between central and local government, the power to do that, to take over places, has not been given yet to local authorities and the elected mayoral situations that we have. And that's something that really needs to happen, or we'll be having other waves of infection going forward over the next few weeks. And we really got to consider, we've now had several probable waves of infection, starting with those who came from Wuhan. We've never really heard about how many of those might have been infected or might have infected other people. Those who've been involved with the cruise liners, those who've been skiing in Austria and Italy, the football supporters from Madrid. We've had these different inputs, if you will, of the virus at different times into different parts of the country, into different places. They will have seeded outbreaks in different places, each with their own profile and trajectory of people incubating and becoming sick, perhaps over about a week after they've been exposed, and then becoming sick in a week or so after that. And during that time, moving around, coming in contact with other people, and generating further waves, several sets of further waves, depending on those original contacts around the country in different places, like a whole series of pebbles being thrown on a pond with the ripples going out. That's what we're facing over the next weeks. And I've just seen coming in that the number of deaths today is up again from 103 yesterday to 182 today. So it's nearly doubled in a day. So this trajectory now is very steep. When we heard about the XL conference centre being converted by the army into a 4,000 bed Nightingale hospital, I really couldn't quite take that in at first. It conjured up for me some of the images of these huge hospitals that were deployed in 1918-19, when thousands of people died in those environments. It's very difficult to see how the normal standards of intensive care can be reached with those sorts of numbers, with the clinical staff stretched the way they are at the moment, and with the lack of equipment that we've got. I think what we should have been doing, and really we need to try and do this still, if it's possible, in places where the epidemic hasn't gathered such huge momentum, is to have places like that to separate off by triaging those who've been exposed, those who've been tested and found positive and haven't become sick, to stop them infecting other people. That's what we should have done 6-7 weeks ago. That's what they've done in places like Bahrain, where I've been advising the government, and where they really seem to be, hopefully, and touch wood, on top of the situation at the moment, at least at the moment. So, you know, I think the approach of trying to build ever more hospital capacity is going to have to be reviewed at some point. We're going to have to start nursing people at home, which is what I've been saying for weeks now, and saving the hospital capacity for really the very sickest people and the fittest people who can most likely benefit from that treatment. So there's going to have to be a rethink at some point if the numbers of cases continues to escalate as it has been doing. Well, I've been very critical since the beginning of February of the slowness of response by the government and the inadequacy of the response. Of course, with everybody else, I welcome the Prime Minister's statement to the nation on Monday. And, you know, I think the failings and inadequacies have been chronicled, they're being chronicled. We've got to park them. Recrimination can come later. What we've got to do, though, is learn the lessons of why we've been so slow, why we've been so ineffective, and make sure that we do the things that we need to do now. And that includes, obviously, this really scaling up of testing, making sure that we're keeping our health workers safe, and making sure that food is distributed equally across the country to those in need, and really reappraising how we are caring for sick people, whether the hospital model that we've been using so far is the right one, or whether we need to switch to a community-based model supporting clinical skills, nursing skills in a domestic environment, the citizens' army of people who are caring for the sick and their relatives and loved ones at home and in community settings. Well, we now see that Spain has had more cases than China. America's now had more cases than China. I'm afraid we are only a couple of weeks behind Spain, and our trajectory still looks very similar. So, you know, this pandemic is the real thing. It's affecting large numbers of people around the world. It's got a toehold now in a number of African countries, in India, in places where the health services are not as good as ours, and where the toll could be horrendous unless they can mobilize themselves, mobilize their citizens, their communities to fight this, as they did eventually in West Africa with the Ebola in 2014. One of the things that came up this last few days was, again, the Cuban doctors and nurses turning up in Italy to help. And, you know, this isn't a political point, but it's a cultural and historic point. But this is very much a legacy of Che Guevara, who was a doctor himself and who was very insistent against Fidel Castro that Cuba should always play a leading role in global humanitarian work and training doctors and nurses for emergencies around the world. There is a center in Havana where I've visited at the invitation some years ago, where they, on a daily basis, assess the emergencies around the world and advise the Cuban government on where they should be sending doctors and nurses, and that's what they do. Wherever you go in a global emergency, you will find Cuban health workers. It's a remarkable phenomenon, and it's a legacy of the often reviled Che Guevara, who was so important to some of us when we were younger. The hope that I think we all have is rooted very much in this phenomenal, spontaneous energy and volunteerism across the country. People networking on phone, online, talking to each other, supporting each other. The amazing work that's being done by the logistics people, by the truck drivers, by the delivery people with the online grocers and all of that. Fantastic work that these people are doing. People who we've taken for granted, 0 hours workers, you know, Deliveroo, these folk, you know, who are now in the front arm, the front line, they're in the trenches of this war against the virus, and we really must be applauding them as we applauded the NHS staff last night. I've had some questions from viewers, and I'll just deal with a few of those now. Lee Coleman asks what precautions we should be taking with packages that are being brought to the door and brought into the house. I think what's happening is that the delivery guys are now getting very careful. They're usually wearing gloves themselves. I think the important thing about this is to just reinforce the importance of regular hand washing when you've taken delivery of something. I think that's the best thing to do. And of course, to stand at a distance when you're receiving goods at the door or the gate. Amy Jade Hayes says she's a transplant patient and she's worried about the pharmaceutical supplies and whether the drugs that she's on will be secure. This must be a real anxiety for somebody in that situation. And we do know that one of the weaknesses of our supply chains over the last 10, 20, 30 years has been to have just-in-time supply in pharmacies, so that they often will only have 1 or 2 days stock in the storeroom of a pharmacy. But I'm absolutely confident that this will be being prioritized by the government as we speak. I mean, I'm not in charge of that, I'm not responsible for that, but I would be surprised if patients like Amy are not being kept at the top of the queue when it comes to those important medicines. Richard Prosser is asking about the emergency powers of government. And I don't think we've really seen the legislation in its detail that's been passed. Some weeks ago now, if you remember, when one of the people who was being quarantined at Ellesmere Port on the Wirral was threatening to leave the hospital, Arrow Park. Okay, Richard Prosser asks, what's the extent of the powers the government have now got in this emergency? I think we don't really know the detail of that. What we do know is that they are extensive. These powers, if you remember, were taken in by the government initially after the person at Arrow Park who'd been quarantined there was threatening to run away from the quarantine environment. And I think the government has got pretty extensive powers. What we've seen over the last 24 hours has been they've been fleshing these out to say that if people are found out and about without good cause, then they can have spot fines, which will accelerate if they commit repeat offences. So a bit like speeding tickets, really, if you will. But we don't know what else they've got in store. We'll have to wait and see. Charlotte Scott is asking about the social distancing and what social activities are okay. Obviously, the basis of this is the 2-meter separation, but also there's this directive about not being in groups of more than 2 unless you're with a family group. And if you're going out walking, then it's really important to respect that. What we've seen over the last week is scenes of very large numbers of people going up Snowdon and in other open spaces, really as though they were in a queue at a football match. And people really have got to use their common sense about what social distancing means when they're out and about in the open air for their 1 bout of exercise a day as directed by the Prime Minister. Ruth and Simon are asking about ordering takeaways. You know, I think this is an important thing if you can do it, if they're available in your area. This will help small businesses stay in business. And as long as the sensible guidance is followed for contacts, for deliveries, then that seems to be okay at the moment. Roy Carter is asking about steps you can take to improve your own resistance against the virus. And again, this is something that I've been advising since early February, that you can take measures, you know, eating fresh fruit and veg, taking exercise somehow, even if you just got a yard or a garden, somewhere to take some exercise, getting regular sleep, not drinking too much alcohol, using this as an opportunity to stop smoking and almost certainly vaping as well, because we just do not know whether vaping gives the virus a leg up down into your lungs when you're inhaling the vaping liquids. Nitin Gupta is asking what we can do to make our politicians more accountable. And this is a difficult one. This is a wartime situation. We've all got to pull together. But this is a democracy. And when they get it wrong, we have a right to draw it to their attention, because we need to get the right action. So we have to work through our politicians. Their offices are still open. You can email them, you can telephone some of their staff in their offices. You can make your feelings known on social media. We need to be doing all of this, because this is still a democracy. We must make sure it remains a vital democracy throughout this emergency. Dan asks about pets. There was some early indication from China that dogs and cats may be able to become affected by the virus. This has been contradicted since, and the answer to this is we really just don't know. But if you keep your own pets in your own place and they're not in contact with other pets, then I don't think there's anything to worry about at this stage. If you've got other animals round and about, then they need to keep their social distance too, just in case, just to be careful. But really, we don't know the situation with regard to pets at this time. Paul Sadot is asking about face masks, and I think this is a very strange area, because we've always been very iffy and rude about the Chinese wearing face masks. But as this epidemic has developed, we've seen a great deal of interest in wearing face masks among British people too. Part of the problem is that these face masks have different specs to them, different specifications. And the ones that really are needed in a frontline situations are the ones that are a 95 mark, that are the sort of masks that the surgeons use. And the flimsy masks that are on general availability when they're available may well not have much impact. One of the things that they probably do though is stop you spitting droplets, coughing droplets over other people. They may not protect you, but they may prevent you from infecting others. And and they may also have the effect of reminding us all about the importance of personal hygiene. Finally, Sharon Baxter is asking whether the government is actually trying to cull the elderly and the vulnerable. I'm afraid, I've been critical of the government through the early weeks of this emergency, but I don't think it's appropriate to accuse them of this. I think we can be critical in thinking that they may have been too slow, that they haven't acted promptly enough or strongly enough, but I don't think we should be accusing them of bad faith. I don't think that that's an appropriate thing to do. So I hope you found these comments helpful. If you've got other questions to ask, please put them in the comments section below the program. And in the meantime, stay safe, look after your families, do the right thing for you and your community. Thank you very much. It's John Ashton signing off. Programs like this are critical in reaching out to people without any prejudice or bias. Open media, alternative media. Join the future of journalism. Join Double Down News on Patreon.